Hello and welcome back to this edition of Bayou Time. Again, your host Keith Weissite, licensed clinical social worker. Thanks so much for joining us. However you may be joining us, we appreciate it very much. And you know, living in this area, knowing how important it is for our health and taking care of ourselves, it's great to hear about doctors coming back to take care of us, especially a physician who specializes in certain activities. We welcome to the program Dr. Logan Ledet. Dr. Logan, thank you so much for joining us.
Thank you so much for having me.
All right, we appreciate it. Of course, an infectious disease doctor, which is so very unique to be able to do that, you know, and we're just very glad to have you here. Tell us about coming to Terrebonne General. Y'all have been talking for quite a while, and here you are.
Yes, it has been a very long process. I grew up in Houma. Becoming a doctor in general, very long process.
Right.
But as soon as I knew that I matched into an infectious diseases fellowship back in 2019, I had started talking to Terrebonne General about coming back eventually.
Right.
You know, life happens, and
Sure.
it happened even more delayed than we expected.
Right.
But a few years later, I'm finally here and getting my practice started.
Very, very nice. I know you've done some hospitalist work here in the past. Tell us a little bit about the difference between doing that and this particular field of infectious disease, which you seem to really like.
Sure. So to become an infectious diseases specialist or a cardiologist or anything like that, everyone starts with medical school and then an internal medicine residency.
Right.
In internal medicine, you kind of learn a bit of everything, of all the different specialties, and you can come out and practice general medicine. So that might be something that you've encountered as a patient in the hospital. A hospitalist is someone who practices general medicine within the scope of inpatient hospital care.
Right.
And then you can go on and specialize further by doing a fellowship. And I did my fellowship in infectious diseases at LSU in New Orleans. So for the last year, my husband was finishing his medical training.
Right.
And so I worked as a hospitalist out in South Carolina. And I'm very lucky to be able to come back and do what I wanted to specialize in, which is the treatment of infectious diseases at Terrebonne General.
Wow, right here. And so can we talk about some of those diseases or illnesses that you kind of specialize in for those people that are not in the medical field? Sure.
I think specifically within the hospital, I think a word that gets used a lot that people might recognize is sepsis.
Right.
So sepsis is an infection with overwhelming systemic illness. So when you come in with fevers, chills, just feeling really bad, and we think it's due to infection, that's sepsis. And when that infection ends up being a little bit more complicated, like a bloodstream infection, or maybe the doctors taking care of you aren't specifically sure exactly what's going on, or you have a complicated wound or injury, that's when I help out. Either figuring out what is going on or figuring out the best way to treat it. Because treatment of infections has become increasingly complicated with the more medicines that we have. And it's helpful to know what to use when, because we always want to give a patient exactly what they need for however long they need it to minimize harm and maximize benefit.
Yeah, and especially with a lot of those patients that are in the hospital, we identify some of those problem areas. You need to identify if we need one of these big-time antibiotics or not, or a combination of some of those to treat some of those things. And it's always nice to have a specialist in infectious disease who's like beyond that hospitalist. Now the hospitalist will be calling you.
That's right.
To ask about those complicated things. And it's so very interesting because wounds can get complicated for so many different reasons. And very often we need that infectious disease specialist to be able to figure out what do we do and how do we treat it.
Right, and that is something that I see both in the hospital and clinic a lot. Things like a lot of people in our community deal with things like diabetes and the neuropathy and vascular complications that can come along with that. So things like foot wounds that can occur not just because of infection, but can become worse because of infection going on.
Right.
That can slow healing. And so I help out with that when patients need either long-term antibiotics by mouth or through an IV. And I see those patients in the hospital and I follow up with them in clinic to make sure that they're getting what they need as they need it.
And that's one of those really important things. We talk about follow-up all the time. It's so nice to have an infectious disease specialist that those patients can go back to clinic and see you, and you can kind of monitor, especially with these slow healing wounds, like you mentioned, with the complications of diabetes especially.
Yeah, that's something I'm really excited to be able to contribute. It's something that I thought would honestly be a smaller part of my practice, but there's been such demand even in the last few weeks that I've been here that I
Right.
think it's going to be a growing need, not just from things like wounds, but I also see patients with things like hepatitis, which is something like hepatitis B and C, which
Right.
sometimes can occur in the same patients. And that's something that I help treat when it gets a little bit more complicated.
Right.
And that's something that definitely affects our community and has a great impact on patients' health.
Right.
Their risk for things like liver cirrhosis and cancer. So it's something that I'm really excited to be able to contribute to the people here and have dedicated care.
Well, since you mentioned you've already gotten so busy here in just the last few weeks, are you taking new patients?
I am taking new patients.
Okay.
It is on a referral basis,
Okay.
usually through a primary care provider, but I also work with our oncologists and surgeons. If there's anything that they feel either from a wound or surgical complication that they need help with, or patients see these medicines on the TV that have all of these, if you have a history of TB or hepatitis,
yes, right.
talk to your doctor.
Right.
I'm the doctor that you will come talk to if you start those medicines. So.
Wow, very cool. And I know how important that is to be able to partner with those people at the hospital, to be able to partner with those hospitalists. But here is the clinic number. If, in fact, you are interested and need more information, you can reach out to Dr. Logan Ledet at 985-873-3484, of course, associated with Terrebonne General Health System. And so welcome back home. And more importantly, thank you for making the decision to come back and be able to build your practice and take care of the people in our community. We appreciate it.
Well, thank you again for having me, and I look forward to working with everyone.
Fantastic. Don't go anywhere. Let me buy you time when we continue.